This is something that we're just going to be seeing every 2 years, probably. People should vote no because it's going to lead to like huge ramifications in the dialysis market. It prohibits discrimination based on payer, which means that a dialysis facility has to take anybody irrespective of what their payment mechanism is. That provision, I think, is the one that is like designed to make people feel like sympathetic. If that's the thing that you really want to do, then put that in a single, like as a separate proposition. Second is the most controversial part of this, which is mandates a licensed physician to be present at all times during dialysis. Probably is better to have a physician there than not, all else being equal. But the costs are just huge. And are there better things for a nephrologist to do? For example, see patients with chronic kidney disease. And I would say yes. We probably can bend the curve in a much more substantial way in terms of like preventing dialysis, helping with outcomes rather than sort of like forcing all these nephrologists to sit in a dialysis facility. One of the major healthcare unions is trying to, hold DaVita and Fresenius' feet to the fire because they are refusing to allow their employees to join the union. This sort of speaks to a major problem in dialysis, which is that the market's hugely consolidated. DaVita and Fresenius have a ton of market share. They have a ton of power. My opinion has always been measure the mortality rates, the infection rates, measure outcomes that a patient cares about. Patient doesn't care about like having a 1-to-1 staffing ratio if that doesn't matter, right? What they care about is they want to stay out of the hospital. They want to survive. When you go to a restaurant, you don't really care how many cooks spent time on your meal. What you cared about was like the price and did it taste good? You really care about the outcome. We know how to be physicians. I guarantee you a congressperson does not know how to be a doctor. They do know how to measure an outcome. So that's what they should be doing.